Hey everybody, if you are a nurse practitioner or PA student, you need to watch this video and take notes so that you know how to accurately compose a SOAP note. A well-written SOAP note will impress your preceptor and show your knowledge and clinical reasoning skills. So today I will discuss what the SOAP note is for, the components, do's and don'ts, and examples. Stay until the end for some pro tips. So when will you write a SOAP note? A SOAP note is written as a follow-up to an H&P or history and physical or consult note, depending if you are working for the admitting service or consulting service, and it is written on a daily basis. In the outpatient side, the SOAP note format is used for a clinic follow-up visit. A SOAP note is not used for an initial evaluation of the patient. A SOAP note assignment may be labeled differently in the academic setting, such as focused or expanded. Always refer to your assignment rubrics to know what should be included. The components of the SOAP note include subjective information, objective data, and the assessment and plan. Be sure to have the correct type of information in its respective parts. So, subjective data. That includes what the patient tells you. You can also add information obtained from the nurse, family, significant other, etc. Objective data includes things you can measure or observe, such as the physical exam, vital signs, lab values, and diagnostic test results. The assessment is where you write your ICD-10 medical diagnosis. After gathering all of your information and critically thinking about differential diagnoses, what are you diagnosing your patient with? The plan is based on each diagnosis. You may plan to do more testing, prescribe medications, order a consult, observe, discharge, etc. Here you will need to justify your plan with clinical reasoning. Let's dive deeper into the subjective part of the SOAP note. This section of the note is where you will write how the patient is feeling relative to the day before or in general since admission. You can add events from overnight and or input from others such as the RN, family, friends, significant other, etc. Remember, the SOAP note, also known as the daily progress note, only captures information from the previous 24 hours. Do not write the past medical history or events of the whole hospital stay. Keep focused on the relevant changes. Do not put your thoughts or plans here. Example, the patient denies having any chest pain or palpitations overnight, feels well today. RN reports that the patient ambulated around the department this morning and the patient denies dyspnea. Another example, the patient reports having 7 out of 10 left-sided chest pain associated with nausea this morning, described as a squeezing relieved with 1 nitroglycerin, currently pain-free. The objective section includes your physical examination of the patient, the morning's labs or most recent, diagnostic tests such as a chest x-ray or EKG and vital signs. The labs and diagnostic tests may be pre-populated in your note if using an electronic medical record. The example listed is a brief template for the physical exam. The level of detail on your exam will depend on your practice. For instance, if you were the consultant for the neurology service, you would elaborate on the neurologic exam. So in general, include general findings such as no acute distress, HEENT, you could include pupils round, reactive, no scleral icterus. Lungs are clear, respiration's non-labored, not wearing oxygen. Heart and vascular, S1, S2, heart sounds heard. Heart is regular in rate and rhythm. No murmurs, rubs, or gallops. PMI, non-displaced, no edema or JVD. Abdomen, soft, non-tender, positive bowel sounds. Neurologic, awake, alert, oriented times 3, follows directions, moves all extremities. Skin, warm and dry, no rashes. Your assessment is where you demonstrate clinical reasoning. Think about the patient's signs and symptoms, exam, diagnostic tests done so far, and possible differential diagnoses. In clinical, you will list the ICD 10 diagnoses that you are treating. In class, you may be asked to list differential diagnoses and to describe your rationale for choosing the particular diagnosis. You will want to pull from the literature to substantiate your diagnoses and include in-text citations and a reference list. When a person is first admitted to the hospital, you may not know specifically what the diagnosis is, so they're admitted for further workup. You may use symptoms as a diagnosis, but update your problem list/diagnoses when more information is available. Always document to the highest level of specificity. For instance, the admitting diagnosis may be chest pain with possible unstable angina, but upon further investigation with cardiac enzymes, an echocardiogram, and repeat EKG, you may diagnose a non-ST elevation MI type 1. Other examples of specific diagnoses include type 2 diabetes mellitus with hyperglycemia, COPD with exacerbation, hypomagnesemia, chronic kidney disease stage 3, atrial fibrillation with rapid ventricular response. Plan. With each diagnosis, write if the condition is stable, controlled, uncontrolled, improved, or decompensated. In other words, describe your current assessment of the diagnosis. For example, if I am managing the patient's hypertension, you can write if you think it's controlled or uncontrolled. The plan will then unfold from there. Describe your plan for each diagnosis, what you are ordering and why. For example, a pulmonology consult was placed for evaluation of left pleural effusion and possible thoracentesis. That makes it very clear to the consultant what we are looking for. Here's a simple example of a patient, of a plan for diagnosis of atrial fibrillation with rapid ventricular response. Continue IV diltiazem infusion and titrate up to 15 milligrams an hour to achieve a heart rate less than 100. CHADS 2 vascular score is 6, so start apixaban 5 milligram BID. Plan for a TEE/cardioversion tomorrow morning. This is appropriate for the real world. If you are a student and submitting a SOAP note for an assignment, you would need much more detail to include references from your textbook, professional guidelines, or research. Students, please avoid using a lot of acronyms in your assignment. So, some helpful pro tips. In clinical practice, be succinct. No one has time to read detailed paragraphs. Make clear the changes that you are making each day. You can do this by adding the date next to the change or using bold font. If there are no changes, you can simply state to continue the current treatment. If you are the consulting provider and you're signing off on the case, be sure to make it clear what your final recommendations are, to include a follow-up appointment if that's applicable. Avoid statements such as follow up with our service in 1 to 2 weeks. Unless you make the appointment, this will likely not happen. Document any related metrics. Cardiac-related metrics include an ASCVD score, which calculates risk for coronary artery disease in patients admitting with chest pain, or a CHADS 2 vascular score to determine stroke risk for a patient with new onset atrial fibrillation, and guideline-directed medical therapy for a patient diagnosed with heart failure. Thanks for watching this overview of the SOAP note. Let me know if you like this type of content and want more.